Hi everyone, my name is Charlotte Green and I'm a graduate student here at Central, and this presentation is about my thesis, which is the impact of universal free meals during COVID-19 on family life and perspective of school meals in Central Washington State. First, we'll do a brief history. School lunch started at the end of the 19th century in Boston and Philadelphia. They started serving lunch Women's Educational and Industrial Union, as well as the Star Center Association in Philadelphia, which is a nonprofit that helps the community members. In 1930s, because of the Great Depression, the federal government became involved because they noticed that the Great Depression was impacting farmers as well as workers, and there was an increase in child malnutrition. So they began to buy food from farmers and gave people jobs to make kids meals in schools. And by 1941, school meals were in all states serving 2 million lunches daily. Though it wasn't law yet, it did not become law until 1946 when the School Lunch Act passed. And then there was the Child Nutrition Act of 1966, which is significant because that is when the school breakfast program started and low-income children started to get benefits like reduced or free meals from this act. The 1980s and 1990s were cuts for the school nutrition programs. They were trying to cut funding, so they reduced portion sizes. It became a little bit privatized, and the quality of food was lower during this time. The Child Nutrition Reauthorization Act of 2004. This act made it easier for low-income kids to eat. It eliminated the applications for them if they were involved in other public programs, and it required schools to implement a school wellness policy by 2006. And the Healthy Hunger-Free Kids Act of 2010 was next, and this is still what guides our nutrition programs today. So a little bit more about the Healthy Hunger-Free Kids Act. It was a culmination of years of work by advocates and professionals. The National Alliance for Nutrition and Activity partnered with several organizations like the School Nutrition Association, American Heart Association, and Academy of Nutrition and Dietetics. And it made politicians aware of unhealthy food that was being sold in schools. These are known as competitive foods. Previously, some schools would serve competitive foods alongside the free and reduced lunches, so it was very obvious who qualified for free and reduced lunches and who did not. So these advocates and professionals educated some politicians on what was happening, and those politicians helped bring that awareness to other politicians. And the dietary guidelines were released in 2005, and this was a prompt for the Bush administration to partner with the National Academy of Medicine, and they released a report in 2007 entitled School Meals, the Building Blocks for Healthy Children. And this is really what set the stage for the passage of the Healthy Hunger-Free Kids Act of 2010. So the Healthy Hunger-Free Kids Act improved nutrition standards. School meals require at least one fruit or vegetable to be offered at each meal, and a variety of vegetables to be offered over the course of a week. Grains and snacks must also be at least 50% whole grain. There are limitations on sodium, saturated fat, and calories through the passage of this law. Also, something called the community eligibility provision was part of this, and schools could opt in if 40 or more students identified as categorically eligible, and that means they participated in SNAP or TANF. So if they participated in other programs, other public programs, they were automatically eligible, and if more than 40% of the population, the school could opt to offer free meals for all. And this was designed to increase access to nutritious food for low-income children, decrease stigma associated with participating in school meals, and decrease the administrative burden of meal applications and keeping track of meal debt. So there has been research on the community eligibility provision. It improves school meal participation, which was one of its main goals. It helps increase household food security, also positively impacts student health and well-being, and improves academic performance. It's important to note that the National School Lunch Program and School Breakfast Program serve 30 million and 14.7 million students per day, respectively, and are often referred to as a social safety net for low-income families. And so while there's research about the community eligibility provision in schools that qualify, universal free meals is a new concept. New as in it's actually being implemented. There have been people fighting for universal free meals for a while, but universal free meals was available to all schools who participated in the lunch and breakfast program during COVID-19 USDA meal waivers from March 2020 to June 2022. And so this study explores the impact of universal free meals on families in our community in Central Washington in the immediate aftermath of the COVID-19 pandemic. So we asked them questions on how universal free meals impacted their students' participation, their family's perception of school food, child's sense of community of food, and child's willingness to try new food. It was a survey. Inclusion criteria was parents and caregivers who were parents and caregivers of students in K through 12th grade in public school in Central Washington from March 2020 to February 2023, which was when the survey closed. Exclusion criteria was parents who did not have children in public school in Washington State during that time period. So these are the results. As you can see, they are breakfast before universal free meals, breakfast during, lunch pre, lunch during. And so breakfast, the people who participated 3 to 5 times a week went up from 14% to 30%. People who participated less frequently, 1 to 3 times, were about the same, though increased slightly. And then breakfast participation, the people who participated 0 times went from 66 to 43. Lunch has similar results, though a little bit more increase, so 31.5% before universal free meals, and then that went up to 55.1. 1 to 3 times went down slightly, but the 0 times went down from 39.3 to 17%. These were yes or no questions if universal free meals were beneficial. So 85% said yes, 14.9% said no. Child sense of community at school, 59% said yes, 40.9% said no. Family perception of school food, 61% said yes, 38.5% said no. Willingness to try new foods, 57.4% said yes, and 42.5% said no. And these questions also had a free answer section. So parents were able to write in how it impacted their families. And so the number one theme for if universal free meals were beneficial was finances, as well as time, convenience, peace of mind. No one who answered no actually said why it was not beneficial to their family. And then universal free meals influence child sense of community at school. More children eating together, everyone eating the same. One parent said that their child didn't participate because of the long lunch line. And perception of school food, school meals ended up being more nutritious than people thought they would. And then some people said they always thought school food to be good. And that didn't go through all the way, but did universal free meals influence your child's willingness to try new food? Yes. And they would see their friends eating. It's a big one. And no, that's because their child always likes to eat the same thing over and over again, or they were a diverse eater to begin with. And so our results, the increase in participation and the overwhelming response that said that universal free meals were beneficial suggests that there is a need for access to school meals regardless of family income. It appears the more kids that participate in school meals, the more likely there was to be changes in sense of community and eating habits. And universal free meals are now law in 5 states, and we're up for discussion in several states' legislative sessions. Future research should continue to dive into the benefits, both for child health and well-being, and the health of their families and society as a whole. And those are my references. Thank you so much for listening.